Good afternoon and welcome to our Elville Webinar Series Wellness Series. My name is Jeff Stauffer, Community Relations Director with Elville and Associates, and welcome to our webinar today, the third in the Elville Webinar Series New Wellness Series, titled Taking Charge of Your Health Journey. So how this will work today, if you're new to our webinars, if you are, welcome, we're glad you're here. And if you're a frequent attendee, we thank you as always for your support of our webinar series. So you as the attendee are in listen-only mode. However, if you have questions, and we want to encourage you to ask questions and participate throughout as they help others learn, please note them in the questions panel on the right-hand portion of your screen, and we will be pausing periodically to address them. Today's presenters will also pause periodically throughout to the presentation to get your feedback regarding what they're discussing. And you can interact through the chat box on your screen as well as the questions panel. So we'd like this to be as interactive as possible. You also received the presentation by email from me yesterday for your convenience to take notes on it if you wish. If for some reason you did not receive the presentation from me, it is currently located in the handouts section in the panel on the right-hand portion of your screen for download at this time. Everyone will also receive a post-webinar feedback email right after the presentation, and we ask that you please just take a couple minutes to fill out this simple survey to offer us your thoughts about the presentation. Also, Elville and Associates works every day with families, with clients, with ideals of client education, collaboration, and compassion in mind, and you should expect nothing less from us anytime that you work with us. We're always available for consultations to discuss your family's planning needs, and we always look forward to being a resource to you now and in the future. So at this time, I'd like to welcome back and turn the webinar over to our presenters, Ms. Ellen Platt of the Option Group and Dr. Michelle Fritsch of Retirement Wellness Solutions, who will share a bit about themselves and get started with the presentation. So Michelle and Ellen, I'll turn it over to you.
Thank you, Jeff.
Thank you. I'm Ellen Platt. I'm a geriatric care manager. We do private case management and advocacy. So for over 30 years, close to 35 now, we've been providing case management and advocacy services for families who are in transitions of care and at those crossroads where they need to make decisions. So what we're going to be talking about today is taking charge of your health journey, sharing some experiences that I've had as a care manager and Dr. Michelle has had as a pharmacist. So Michelle, I'll let you introduce yourself.
Thank you. So I'm Michelle Fritsch. I'm a clinical pharmacist, and I founded Retirement Wellness Strategies because after years in healthcare, I saw too many people that struggled to navigate from their primary career into retirement while preserving their health and maintaining their health long term. So I've now completely altered my career to focus on that area. And it's why Ellen and I work so well together, because when you think of before retirement, through retirement, and in the years ahead, we both are advocates for that being a very healthy journey for you. And that's why we're here. And Jeff, we're so grateful that you've invited us. We will tell you toward the end about a new venture we have called Propel, which stands for Powerful Retirement Options for a Purpose-Filled, Engaged Life. So we'll look forward to talking to you about that a bit later.
So one of the things that we want to do is, we've talked in some of the other seminars, if you've been on with us, about wellness and taking care of yourself. And so one of the things that we're going to do is, just since you guys have carved time out of your day today to join us, want to take a couple of minutes just to kind of revisit some of the breathing techniques that we had done in prior webinars. Just again, practice makes perfect. Practice makes things become a habit, and taking care of ourselves is really important to do. So let's just take a couple of minutes here. It's going to be really quick. Just sit yourself where you're comfortable in your seat, your arms are relaxed, maybe you have arms on your chair, and just take a couple of deep breaths. Deep breath in, really fill the lungs and the abdomen to the count of 5. Hold it for the count of 5. And then exhale for the count of 5. And hold it for the count of 5. Inhale for the count of 5. Hold it for the count of 5. Exhale for the count of 5. And hold it for the count of 5. Just continue to do that while I'm talking, and just gently take those breaths, nice and slow. Try to clear your mind. Do a quick body scan and see if there are any areas that are still holding tension. And if you find an area where you're holding tension, as you exhale, just imagine that tension going out with your breath. Continue with that box breathing for the count of 5. Inhale, hold, exhale, hold for the count of 5 each. When you inhale, find an area that has tension. When you exhale, imagine that tension just leaving with your breath. If you need to adjust yourself to find a little more comfortable position, or roll your shoulders and kind of work that tension out. Continue with just a couple more breaths. Okay, we're going to come back to the group, and I'm hoping that you feel a little bit more relaxed and a little more centered and focused. We're going to talk about some ways that you can take care of your health journey today. So this is a question that we want to put out to everybody, is wondering how in control you feel of your health journey. And so you'll pick one of those: out of control, minimum control, mostly in control, or totally in control. So think about that and think where you feel that you are today, and hopefully at the end of this you'll feel further along that continuum with some of the tools and tricks that we're going to share today.
A lot of times when we talk about health and wellness, people kind of immediately jump to any diagnoses they have. I have high blood pressure, I have diabetes. But we want to really broaden the scope of how you think about that. And so the diabetes or high blood pressure, those are things we would consider physical health. That would include things like sprained ankles or bad shoulders or things that hurt. But just as important is your mental health. And I think we're going to find in the last 2 years, a number of people have struggled with this. Have you had any periods of feeling depressed or down? Have you had times where you have felt anxious or out of control? You know, we were just talking about control. Emotional health is more sort of moment by moment. How do you manage the kind of highs and lows that come your way? Do you kind of really take care of yourself emotionally and you keep those to small waves? Or are you kind of driven by each thing that comes your way, where you feel like you're really high and excited and then really low with the next thing that comes that's not as positive? How about your social health? And that is relationships. I know it's been difficult during many periods of this pandemic where you can't be as together with the people that you want to be with. Have you found other ways to keep your social connections strong? And the big thing we want to avoid is isolation, that you get to a point where you feel alone and you don't know where to turn, you don't know who to call. So we highly encourage you to keep those relationships strong, maybe even in new ways during the pandemic. And then your spiritual health, whatever that looks like for you, I find it fascinating when you look at the literature, because that's what we do in medicine. There are many studies that show that identifying your spiritual health and helping your spiritual health to grow is just as important as your physical, mental, emotional, and social health. So I encourage you to take a self-inventory. In which of those areas are you functioning with great well-being? And in which of those do you feel you need to place some focus in the next few days or weeks? I want to give a visual of what seems to have happened to a lot of my patients or a lot of my clients over these last several months. We've kind of been driven by stress and fear. When you think about the brand new pandemic, we knew nothing about it. It was all new. And then it feels like every step since has brought some questions, some new data, some challenge to figure out what to do with that. So when we are driven by stress and fear, what tends to happen is we stress eat and stress drink. I would love to hear from you if you have not done that, because I think we've all done some of that. Poor coping. Even if you were good at handling things earlier, it's harder. It's harder when your brain is so busy with all of this new information it's trying to figure out. Anger. Has your fuse been short? If someone cuts you off on the highway, does that make you a lot more angry than it did before? Do little slights feel big now? I think that's true of a lot of people. And again, your brain is just trying to process so much change. And then sleep. If you've ever heard me talk about anything, I'm always going to mention something about sleep because it's so important to our overall health. So when we start doing those things, stress eating and drinking, not coping as well, short fuse, not sleeping great, then that leads to our blood pressure tends to go up. When our blood pressure goes up, it increases the risk of heart disease and other things not working as well as they should. Our kidneys can decline. Our brain can sometimes not get as much blood as it wants as the blood pressure goes up. So that is one effect. Another one is our weight tends to go up, especially with that stress eating and drinking, but also with that not sleeping well. And then when your weight goes up, your blood sugar tends to go up, so risk of diabetes goes up. And then chronic pain. When we are feeling anxious, pain feels worse. And so I'm sure you've been in a situation where the doctor asks you to rate your pain between 0 and 10. 0 is no pain and 10 is the worst you can imagine. And let's say it's a pain, maybe your shoulder's aching. And normally you would give that a 3. When you're really anxious and you haven't been sleeping well, it's going to feel more like a 7. And that is common for everybody. So part of relieving that pain is the deep breathing Ellen just led us through, reducing our stress levels, getting better sleep. Because if we don't, then this whole stress fear cycle just gets exacerbated and worse. So sometimes I think it helps us take control and figure out what to do when we realize these cycles and where they come from and what makes them worse. So I encourage you to take a minute to look at this and identify a couple of things you could do to reduce your stress, reduce the fear. I suggest one being not watch so much news and stay off of screen time as you can, because it's just this constant feed of fear-mongering information, it feels like sometimes. So give yourself breaks, use the breathing activities, maybe change your diet habits, try to give yourself more space to not get angry so easily. Identify a couple of personal goals of things that you could change here. So with that in mind, we're going to move. We're just going to take a little opportunity to move. So like Ellen had us breathing, let's continue to do that. And a couple of places that tend to cause people to have pain are the shoulders. So I encourage you to just gently roll your shoulders, let some of that stress in your neck and shoulders go away. And then I also encourage you, if you're sitting, raise your feet off the floor, if you can, comfortably, and roll your ankles and pull your feet down, like point your toes, and then pull your toes back toward you. And anytime you do these sorts of stretches, you just want to go slowly so that you really feel the pull, feel the stretch. Obviously, don't hurt yourself, but do allow that stretch to get uncomfortable so that the next time you do it, you can actually stretch a little bit further. So I'm going to be quiet for a few seconds. That's hard for me. And I want you to roll your shoulders, point your toes, pull your toes up, and breathe. See if you can relieve some of that tension and pain as we move forward.
This is a great exercise to do in conjunction with the breathing. And again, as you're rolling it and working out that tension, you're exhaling that tension with your breath.
If you did some of these things with us last time, and then you've practiced them and used them since, we would love to hear that. If you want to mention in the chat what you have found helpful, we would very much love to hear that.
Michelle and Ellen, I can tell you, and I'll just share with the attendees that, and as we talked about over lunch the other day, that I have done the breathing exercises every day, numerous times, and I can't tell you how helpful that has been for me, especially as somebody that doesn't sleep very well. The breathing exercises have been a game changer for me. So thank you for sharing that information with me.
Great.
Thank you for sharing that.
I also
Ellen,
shared it with my daughter, and she's now a fan of breathing exercises as well. She's only 12 years old.
And
I
that's a
love
great age. Yeah, that's a great age to start it as a habit.
Ellen, you want to walk us through disease?
Sure, sure. So when we start talking about disease, that's when a part of the body or a system in the body begins to function maybe inefficiently. And so that it can snowball. And a lot of times the first time we go to the physician for treatment for some new symptom, very often it's related to stress. Stress, the mind-body connection is a very strong connection. So as we start to be mindful and we start to use these breathing tools or these moving exercise tools, it helps decrease stress rather quickly if you're mindful about it, and keeps the inner anxiety down. So we try to keep the disease away by doing things like being mindful, taking care of our bodies, moving, finding things that are relaxing to us. Maybe it's a hobby, maybe it's an interest, maybe it's time with a friend, but it's carving out time in our hectic schedules to really take care of ourselves and just slow down the pace a little bit. So we want to avoid disease, and these are some of the ways that we can start to do that. We want to talk about illness, though. So there are two kinds of illnesses. Acute illness, which is something that pops up, is happening to us right now, usually is episodic. So it may be something like a sprained ankle or an ear infection. It's something that came up, it's hurting us, bothering us, could be pretty intensely right now, but we receive treatment, and it might be medication, it might be relaxation, it might be physical therapy, it might be something, just some time off or taking a sick day. But it's something that comes and then tends to go and doesn't come back. When we have chronic illness, that's something that is ongoing. It affects your health over the long term, And there's often no cure. It may be minimizing the symptoms or slowing the decline, but it might be something that you're going to be dealing with for the term of the life. And that might be diabetes, which you manage by following the blood sugars and taking insulin or medication to help maintain it. High blood pressure is keeping that down so it doesn't lead to other. So a lot of times these chronic illnesses, if they're not managed or the progression is slowed, they may then go into some other type of condition. So we want to avoid that. And again, it is thinking about that mind-body connection and how we can be proactive in our health. So again, being proactive is really taking a good look at our health, taking an inventory that we can share with our doctors, increasing that communication with our healthcare team, and whether that's families, physicians, physical therapy, caregivers, is just making sure that everybody is on the same page.
Absolutely. And when you think about whether you're the CEO of Google or a 2-year-old toddler, there are things that we all have in common. There are elements to our overall life that we have in common, and I think we sort of lose sight of that sometimes. So when we think about our overall health, I'm just going to describe it a little bit differently than we did before. There's our biological health, our body, how's it functioning. There's our psychological health, our social health, and our spiritual health. And 3 key ways that those things come together are that we all need some sense of meaning and purpose. And if you let me get started talking about that topic, we could be here for days. But I think it's the #1 factor for people who transition from one life phase to another and do so beautifully and love each phase, versus the people that get stuck in a phase and find rapid health decline, is have they found that sense of meaning and purpose in the next phase of life? So I encourage you to kind of think about that in your own life. The next one is your self-worth. We all need to be part of a group and to belong and to know that we bring an important element to that group. And you do. At every phase, you do. So finding those places where you've got your support network and you belong with that group. And then the last one is we talked earlier about avoiding isolation. We all need those close relationships where we can love and be loved and be supported. And so I encourage you to think of your life in this standpoint. And are there any elements here that you might want to put on your to-do list of things to give some more thought or to kind of work on in the next few days or weeks? So many diseases and illnesses are preventable, and sometimes we can completely get rid of them and reverse them if we're proactive, if we identify them early, and we're really engaged in our health. So we wanted to take a little bit of time and give you some really tangible strategies to get engaged in your health and to really work well with your healthcare team. I think one of the most important things is to make sure that anybody making a decision related to your health has all of the right information before they ever think about making a decision. And unfortunately, right now, if we're not active, a lot of times decisions are made based on available information, and that may not be the full picture. And so things are misdiagnosed, medications might not be appropriate, tests are ordered that shouldn't have been ordered not because it's a bad doctor, because they didn't have the information they needed. So we're now going to help you make sure you're giving your doctor all the key information that he or she needs. So to get started, I'm the pharmacy person. So I want to make sure that any medication allergies you've had or food allergies, an allergy means a reaction like a swollen tongue or difficulty breathing or a rash. But you also might have intolerances, medicines you took that you just didn't like the side effects. Keep a list of those. Make sure that any doctor making decisions about medicines for you has those. Make sure there's a list of all your diagnoses from any doctor that has declared that you have this or that complete list is given to each doctor making a decision. All your surgeries, procedures you've had, your family history, especially your kids, your siblings, and your parents, maybe even grandparents, any medical conditions that they struggled with, things that might have happened to them, and therefore you're at risk of those things as well. Your insurance information, especially if a decision is going to be made about a procedure or a test to be ordered. If they've got your correct insurance information, they can check and make sure that payment-wise it's going to be approved. Vaccinations. Fairly recently, we've learned that some vaccinations, beyond COVID vaccines and flu vaccines, we learned that there are some vaccines that as we go through different phases of life, we should really receive boosters of those things. So make sure you're talking to your primary care team about making sure all your vaccines are up to date, including now there's a new, more effective one for shingles, pneumonia vaccines. There's just so much to think about at various phases of life. So ask that question to say, please make sure my vaccines are all up to date. And then medications, I have seen this so many times in my professional lifetime that people will just mention the medicines that have been prescribed. But I know most of us take so much more. So be sure to include things like vitamins, supplements, all the over-the-counter stuff you buy for the occasional stomach ache or the occasional headache. We need to know those things. Any cannabis that you use, tobacco products, it's all important. So have a really comprehensive list, even if you don't take them every day. If you take them once in a while, we need to know that. And I've got many stories to tell you as to why that's important, but I don't think we have time today. So if you ever want to know them, reach out to me. I'm glad to share them. And then share this with your whole healthcare team. Now, when you're preparing for medical visits, we want to make sure that a lot of times people just kind of passively show up and they're okay, I'm here, I'm in my appointment. And I don't know about you, but it feels to me like healthcare is kind of rushed right now. And so rather than walk in unprepared, there are a lot of things you can do to pre-prepare and make it a more meaningful and efficient conversation with everybody in the healthcare team you encounter. So one is give yourself plenty of time to get there so that you're not feeling rushed. That will also allow your blood pressure to calm down, and so you're less likely to be misdiagnosed with high blood pressure just because you were running in the door. We don't want you to feel too rushed, because if you were with us last time, we talked about how when we're feeling anxious, the part of our brain that makes decisions is not really thoughtful. But if we can relax with the deep breathing, with the stretching, if we can relax when we get in there, we're more likely to remember all the things we want to tell the doctor about. And then I encourage you, even better, write it down. What do you want to talk about? Prioritize those things. And if there are any details, maybe a new condition or a new symptom you're experiencing, write down those details. And ideally, actually take 2 copies. One for yourself, take a pen, take notes as the doctor's giving you answers, but also give 1 copy to that medical assistant that checks you in at the beginning of your appointment. And then he or she can take that and give it to the doctor. The doctor's looking at it, walking in the door, and comes in prepared to talk about those specific things that you've outlined. I've, at this point, encouraged thousands of people to do this, came up with this process by working with doctors, and we've gotten great feedback that everyone gets more out of their visit. They feel that the better decisions were made and that everyone's on the same page. 2 more things. Write down what you hear. I mentioned that, but it's so important because when you get home and you're not sure, did they say this or did they say that? And along those lines, take a second person with you as to just also be listening in case anything isn't really clear or you just can't remember exactly what was said. And then often when you leave, you're given some sheets of paper or instructions to schedule a follow-up visit with this kind of doctor and a follow-up visit with the dietitian or whoever. Make those appointments right away because there's often a lag time until you can get the appointment, and it's so easy to lay those things down and forget about them. So that's a lot of tips. That's a whole lot of tips. Really fast.
One of the things we really want to encourage you to do is make your appointments with your doctor as collaborative as you can. Making sure you're updating them with current information, making sure that you're sharing any concerns that you might have, coming in again with that list of questions to make sure that you can stay on track and have all your questions answered. A lot of times we come in, they're in our head, but the conversation gets us sidetracked and we walk out thinking, gosh, I meant to ask about this. And it's much harder to track the physician down and be able to get the information. So having that ahead of time, being prepared, walking in, being collaborative with the physician and having a really good relationship with them is exactly what you want to be able to be proactive with your health.
Absolutely. And Ellen, this next principle, you explain it so well.
Well, when the news might not be good, we may get into a appointment with our physician and we have some testing that might not be good. And what's the first thing that happens? Our anxiety heads way up. And so we don't want to worry about it until we have to worry about it. What we want to do is we want to educate ourselves. We want to find out, really get good information from the physician so that we can go and educate ourselves further after that appointment. So we want to ask, what does this mean? Understand how we have this condition and what kinds of treatments are available, what options are available, and what can we anticipate? Is it reversible? Is it something that's progressive? What do we need to know now, and what do we need to start thinking about in the short term, and what do we really need to start planning on? So we want to deal with that uncertainty. We want to keep our anxiety down, but we want to empower ourselves with information and tools. And that doesn't mean Dr. Google. It doesn't mean Dr. Google. What we often have, people will automatically go and Google a condition, and they may not be getting the information from a reputable source. So maybe ask the physician for a reputable source. Maybe it's the NIH, maybe it's the Mayo Clinic, maybe, you know, some type of organization that is known for good sound clinical information. So we want to make sure that we do that. Looking for support groups with a certain disease state might be good. If it's diabetes that you've been diagnosed with, we want to make sure we can learn how to manage our sugars, blood sugars. How do we track them? How do we, what do we do in terms of insulin? And how do we counteract what we can? How do we control what we can? And, you know, a big part of that is empowering yourself with information.
Absolutely.
So when things are uncertain, we might need to wing it. We might need to improvise, but then we're going to start adapting quickly and getting that information. So we're making good, sound judgments and good, sound decisions. Again, collaborating with the physician, calling them for additional information, going for the follow-ups, and your care partners. A lot of people think that, you know, the doctor is the one that makes the decisions and that's it. But we really are a big part of our care decisions. And so they're good for a sounding board, they're good for information, but they're not the end all be all. We need to take the information and incorporate it into what fits with us. So we might have to be flexible, we might have to be open-minded, think creatively, and sometimes we need to try something new. If we tried something that to counteract a symptom and it's just not working, we might need to think of a different way to solve that problem or minimize the symptoms.
Yeah. So Ellen, what about now that the holidays are upon us, what can people do to incorporate all these great principles specifically around this time of year?
Well, this time of year, we all know we start getting invited to things, and we start getting our schedules get busier, and we start getting pulled in a number of different directions. And so again, it's just carving out time, mindfully carving out time to do some of those deep breathing exercises. Maybe it's the first thing in the morning when things are quiet, get up 10 minutes early just to have a little bit of time to yourself before the hectic pace of the day. But also, as we're thinking about getting together with people, maybe we didn't do that last year because of COVID and we were socially distancing. We might start to get together. We want to remind people to use the precautions, use your common sense when it comes to COVID and washing your hands, possibly wearing masks, shifting to smaller groups, doing things outdoors if that's possible, and just, again, using good common sense with the information that we have and the guidance that we have regarding COVID, but also thinking about ways that we can simplify, whether it's not having that huge gathering all at once, maybe it's a potluck instead of one person doing all the cooking. Maybe it's coming down to the basics, remembering those family traditions or those rituals that make those holidays more meaningful, and is focusing more on that and less on the hubbub and all the extras. Making sure that we're hydrating, making sure we're being mindful of our food intake, and especially being mindful of alcohol and sugar and caffeine intake, because they do change the way we feel and change the way that we interact with others.
Very true, and I'm guilty of not always doing that very well. So right along the lines with exactly what Ellen was just saying, these are just some more specific sorts of things that you can think now, make a list, maybe write ideas to yourself at this point in this presentation. What are the things that stress you about the holidays, and which of these sorts of activities could be most helpful?
Yeah. And figuring out what works for you is really important. What may be relaxing and fun to one person may not be for another. So it's maybe trying some different things, or asking a friend to try something new with you. And not only does that give you socialization and a way to be able to spend time with somebody you like, but trying something new is a really great way to engage your brain. And that's how we maintain our cognition as we age, is trying something novel, learning something new. And you might along the way get a friend and also get a new skill, something else that you enjoy when you have extra time. So to fit those into your life, I mean, we're all crazy. We're all running from here to there. We all have schedules with work and kids in school and trying to keep things going. But we want to start scheduling a time to practice these daily, finding ways that we can fit it into our schedule, whether it's blocking out time on your calendar or doing it right after you do something that you normally do on a regular basis. So it's a little trick. It's called habit stacking. And it's coming up with a habit that you do without thinking. It might be like brushing your teeth or something like that. You do that every morning. Stack a little habit. Maybe after you brush your teeth, you sit down with that fresh breath and you do 5 minutes of slow breathing. Doesn't take a long time. It doesn't mess up your schedule for the day, but it's a way that you can kind of stack a habit on something that you're really good at doing every day. And you have these small victories throughout the day of finding time to take care of yourself. Mindfulness. And Michelle, I think you can go to the next slide.
Can I mention one thing before we go? Is that okay?
Yep.
There's usually some aspect, I shouldn't say usually, I've had many people in my life who've described some aspect of the holidays that is difficult for them, whether it's being with a relative who maybe you disagree with a lot and you find it difficult to be around them, or one particular day and all of it is just so hectic it wears you out. rather than think about the dread of that element that you don't like as much, plan ahead. What can you do to minimize your exposure to the parts that you don't like? How could you incorporate some of the things we're talking about? You know, that person's ranting on and on and on about something that you just disagree with. How could you be doing some deep breathing without them even knowing it at the same time? Or relaxing parts of your body purposefully while in that situation? How can you have just a few soft comments pre-prepared that you could say in response to some things you anticipate will be part of the conversation? So just how can you watch out for yourself moving into that part? So thank you for letting me squeeze that
Sure.
in there.
Something I could add to that, Michelle, too, is that, holidays usually are centered around family and special people in our lives, and your circumstances may have changed, or you may have lost a loved one. So again, sometimes those anniversaries or the first holiday when somebody that used to be there for the holidays is not there, give yourself a little extra time and space to be able to deal with that. It often sneaks up on you when you don't expect it. So you may be like in a group situation and then remember a loved one that's not there for this event. So just be prepared that that could happen, and give yourself the extra space and find the support that you need to get you through, especially the first one or a particular anniversary of one.
Great point.
So fitting them into our lives is finding time, habit stacking we've talked about. Avoid practicing when you're tired. So, if you're tired, you probably need that sleep, and that's probably more important. But getting good rest, good blocks of time where you're sleeping, being mindful instead of just turning on the TV or just getting on a game and doing something that is mindless. Sometimes that is relaxing, but it can also be a time suck. It can take a lot of time, and then you feel like you're harried and you've run out of time to do the things that you wanted to do. So we want to make sure that we're spending our time mindfully, and instead of getting agitated or irritated because we're waiting in line and it's taking too long, maybe that's time we fit in some breathing or stretching our shoulders, or realizing just striking up a conversation with somebody next to you to kind of pass the time. But you expect ups and downs. It's not always going to go perfect. Thinking creatively, give yourself a little bit of grace, and just try to get back on track if you do fall off track. And one way to do that is surrounding yourself with a supportive network and people who are going to be your cheering squad to help you stick to your goals, help you. They may have some goals that they want an accountability partner, and you guys can keep each other on track.
So we've talked about some of these, but any other tips on relaxation during all of this busyness? I will say you and I had a great discussion the other day about weighted blankets, and what a way to just sit and it just adds a layer of relaxation if anybody is interested in trying out a weighted blanket.
Yeah, and if anybody has some suggestions of things that have worked for them, put them in the chat. We'd love to share them here towards the end. If you have some things that you've found that particularly work well for you, please share your wisdom with everybody else.
I hope one of the things that you're hearing really loud and clear is that it is a-okay to take care of yourself during all of this busyness, and ultimately it will keep you out of that loop that we talked about earlier, where high stress levels can just really start a cascade of other negative things. So go into these holidays, maybe if you've not known to do these things before, I'm hoping this holiday season will be so different for you because you've got some new strategies, and that you come out the other end of it more relaxed and having had more positives by the time we reach 2022 than you would typically have at this time of year. So Ellen, you want to tell them about Propel? I'll add some things as well.
Yeah, so Michelle had mentioned that at the beginning, and in the work that we do together, we found that we were always intersecting with families who were trying to figure out how to empower themselves in their healthcare journey and how to be well. And we found a lot of folks who were getting near retirement or had already retired, but they hadn't really planned on what comes next. So we find that there's often this downward spiral of depression or feeling out of control, or feeling like your social network at work or your identity of the work that you had done suddenly is gone. And we forgot to plan about what's meaningful for us. Where's the purpose for us going forward? How do we minimize symptoms or minimize the progression of a disease? How do we avoid it altogether? And so we've put together Propel Comprehensive Wellness. And it's going to be some vignettes and some tools and some videos that are going to be able to empower people to take care of themselves and give them some ideas and thoughts that maybe they hadn't had, and give them a plan going forward of things that they could start thinking about and being proactive and educating themselves.
So this has been our COVID project, if you will, realizing that more people could get access to these things if we put it into almost a self-guided process, where a lot of the information we would typically share one-on-one with a client, that we've put all of that into workbooks and videos and tools that people can use, and we'll be launching that very soon. So I think Jeff has said it's okay. We'll get you information about that if you're interested. Now I'm going to jump ahead a little bit. We were going to try to show a video and it wasn't cooperating. So let's jump on ahead to New Year's. Before we are gathered together again, we will have entered a new year. So what do you envision for 2022? I encourage you to take a few seconds and really think about that.
And for this first phase, just write down whatever comes to mind. Quick, free association. Whenever something comes to mind, just write it down. You might have a list of 5 things, you might have 10 or 20 things, but getting them down on paper and then really starting to look at them. And then maybe picking your top 5. And this is something you can continue to do after our time together today, but this is going to set up for what we're going to be doing in January when we come back.
Absolutely.
So if you pick your top 5 things, you don't have to do it now, but we're going to come to the next page. And this is how we start setting some SMART goals. We want our goals to be specific, not just, I want to lose some weight. I want to be more specific. How can you measure it? Come up with some real clear measurable goals, maybe some interim steps to the big goal. Is it attainable? Is it realistic? We want to have successes, and it may be a couple of small goals going again to that big goal, but we want things to be realistic and attainable. We want it to be relevant to our health, relevant to what we want as we grow, as we age, so that we're still growing and evolving as a being. And then we want them to be timely. Again, realistic in time frames. We want it to be really applicable to our life today and the things that we're thinking about on our list.
So I have an example. On Thanksgiving Day, when all the cooking is going on and there's a lot of people asking questions and we're trying to get the table set and get everything out, and I inevitably have something that's not going to be ready when everything else is ready. During all of that, I will incorporate some of this breathing to keep my tension level down so that I'm more enjoying the people in the process than I am stressing about my rolls that burned or my thing that I forgot to get in the oven on time. Is that just me? Am I the only one that struggles with that? And again, we would love to hear from you. What have you heard today or any of the first 3 sessions that makes sense to you, that you're going to incorporate, you feel like they could make a difference for you moving forward?
I know people are out there, Michelle and Ellen,
The processing.
processing. I can just say for myself, just being more mindful of my health, and these sessions have helped me just think and kind of have a conversation with myself about a lot of these topics that we've discussed over the last few months. And so you just asked about writing down goals. I mean, I just jotted down 10 of them in 45 seconds. So I look forward to our January discussion very much. So so it's been extremely helpful for me. Thank you.
Well, thank you for your time. Appreciate everybody coming out, and our contact information is there if anybody wants to reach out or have any other questions after today's presentation.
Yeah, please do reach out. And if you want more examples or strategies for any of the things we've talked about, these things are obviously near and dear to our hearts. They're things that we work with clients on all the time, and we'd be glad to share those with you.
Well, thank you again to Ellen and Michelle again for a great presentation, part 3 of our wellness series. And like we said, we are going to come back in the new year to a theme of setting goals for your health in the new year, which I'm already looking forward to. And if you have any final thoughts or any questions, now would be your time to get them over to me. As far as some follow-up for this presentation, I'll send the video out to you. Also, I've had a couple of requests from some people to send out the color portion of the slides. I know most people don't prefer that, but they've asked for the color copies of the slides, so I'll send that out in my follow-up email to everybody. As far as our webinar series is concerned, we're slowing down just a little bit as we enter into the holidays. So we've got 2 more presentations before we round out the year 2021. December 13th, the Essentials of Estate Planning and Elder Law with Steve Elville, and December 15th, Legacy, Charitable Giving, and Philanthropy, also with Steve Elville, again on December 15th. And then we're going to take a little break, and then we're going to come back really strong in the new year. So looking forward to jumping into it again. So again, want to thank Ellen and Michelle for their partnership. I also am going to send out the video link for their new venture, Propel, which I've gotten a sneak peek at, and it's very intriguing, and I encourage you all to take a look at it and reach out with any questions or thoughts that you have about it. So again, thank you for being part of our webinar series today. Hope you have a wonderful rest of the day and a wonderful Thanksgiving. We'll see you all soon. Thanks.
Thank you.